Hello and welcome to another edition of For the Record. I'm Sean Murphy. My guest today is Yolanda Bowles. She is the Director of Community Outreach for UCFS, and it is her first time on the show, so welcome to the show.
Thank you.
We've had a lot of UCFS shows on with different departments, different programs that we've talked about, but as a reminder, what is UCFS?
UCFS stands for United Community and Family Services. We are a federally qualified health center look-alike, which just means we're a community health center. We offer medical, dental, behavioral health services for the whole family. And then we also have a whole host of community-based programs as well. And that's sort of where I fall into the organization.
Now, community health centers, it's starting to become a thing, isn't it? It's an alternative to the more traditional methods that you might use, but they seem to be becoming more popular, aren't they?
Well, I think, you know, there definitely is more of a need for community health centers, and they're expanding throughout the country. The federal government is expanding them throughout the country. You know, we are one of several here in Connecticut. And it's really the same as going to any other doctor. I think what makes us unique is we offer all of the services under one roof at our Norwich Health Center especially. And we accept any insurances, state insurance, private insurance, but then we also offer a sliding fee scale for people who do not have insurance.
So is it designed kind of for people with income issues, or really anybody can use the services,
Anybody
right?
can, yes. It's not really based on income, but it is, I think community health centers were created so that people with state insurance and no insurance especially have a place to go where they can get affordable health care.
And that certainly is appropriate, you know, for what we're going to be talking about today, certainly
Absolutely.
too. So Director of Community Outreach, what does that mean?
Well, I supervise a department that is basically all grant-funded programs aimed at bringing services to the community. So one of our main programs is our Access to Care program. And that program is really all about helping people enroll in state insurance programs, which in Connecticut is the Husky program. So we've been doing Husky outreach and enrollment for many, many years, as do all community health centers in Connecticut. And we reach out to our patients, but also members of the community. So you don't have to be a patient to benefit from our services. The Husky enrollment services. And now with the advent of the health insurance exchange, we've expanded our services, and we are all certified application counselors with Access Health CT, so we can also help people enroll in plans through the insurance exchange.
Now, as we tape this, we are in what would be known as the open enrollment period as far as Access Health Connecticut is concerned?
That's correct. Open enrollment, this is the second open enrollment period, which is for insurance effective January 1st. It began November 15th and it runs through February 15th. It's the same as an employer would have an open enrollment period for their employer-sponsored plan. So it works the same way. People have a limited amount of time in which to enroll, and then once they enroll, their health care coverage is good for the until the end of 2015.
Now, are we at the point now where people are obligated to get their own insurance if it's not offered through their employer at this point?
That's true. People are obligated under the Affordable Care Act to enroll in some sort of health insurance plan, whether it's through their employer or through the health insurance exchange or through the Husky program, depending on what they're eligible for. And if they don't enroll, if they're eligible but they choose not to enroll, then when they file their tax return, they will be assessed a penalty.
And that's a financial penalty.
That's correct.
And I think that the way I understand it, the penalty starts out lesser, but then kind of increases over the course of time as this thing continues to roll out.
That's right. So for 2014, the penalty is $95 or 1% of gross income, whichever is more. For 2015, it's going to go up to $325 or 2% of gross income, whichever is greater.
You know, the thing is, and you've heard people, you know, the comments made that it's still less expensive to just pay the penalty than it is the insurance because of how expensive insurance is. On the one hand, you want it, you need it, and you would hate to be without it. On the other hand, there's a big difference price-wise between the penalty and paying for your own insurance.
That's true sometimes, but you know, so you have to kind of weigh your options. It's really good to be well informed,
Right.
either to you know, to call Access Health and talk to somebody through their call center, or go through an insurance broker. There are many insurance brokers in the area that are certified application advisors through Access Health as well, or through a certified application counselor like ourselves at UCFS. Because until you really know what you're eligible for, it's kind of hard to make that judgment, you know. So, and it's much better to have health insurance, you know, God forbid something catastrophic happens. You could run up bills for hospital care into the hundreds of thousands of dollars, you know, if you didn't have health insurance, and that definitely is more expensive than the penalty.
Sure is. Insurance is, you want to have it but not ever use it. You know, that's the thing.
Right. Well, and the good thing about one of the good things about the Affordable Care Act is that a lot of services are covered 100%. So anything preventive is going to be covered 100%.
Physicals and things like that. Right?
Physicals, any kind of screening test like a mammogram or colonoscopy. So there's a real emphasis on helping people stay healthy so that they don't end up in these, you know, catastrophic situations with chronic diseases or emergency situations that can be very expensive.
And that's better for the individual, but also better for the insurance company too, because it costs them less money. Right?
Exactly, and it's better for the economy because if you're, you know, if your society is more healthy, they're able to work and, you know, be productive members of society and contribute to the economy. So it really helps all the way around.
At this time of year, because it's open enrollment, you must be inundated with calls and visits and all that stuff,
We
right?
are. But the good thing is we have a partnership this year with Access Health CT. They selected UCFS as a partner to create an enrollment center. So they have two enrollment centers, one in New Britain and one in New Haven, that are permanent. And what they did this year is they selected several community partners and set up small enrollment centers at those locations, and UCFS in Norwich is one of them. So,
what do you think when people are coming in and asking questions? Obviously, they don't know the answers, and they need your help. What are some of the biggest the questions that are being asked?
just basically how it all works, you know, what...
Oh, that's all. Huh?
Yeah, that's all.
Yeah.
There's a lot of just general questions. Some people go online and they try to apply on their own, and they get, you know, it can be a little bit confusing. They don't want to make a mistake. And so they're, you know, they just want more information. They just want somebody to help them along in the process, and that's a very good thing. So we are happy to help them out.
True or false? It's a little bit easier if you were going to just go through Access Health Connecticut, the website. It's a little easier and a little less daunting and a little less crashy, I guess, this year than it was last. Or things have improved a bit, right?
Yes, I would say so. I think things are working better than they did at the start of open enrollment last year when it was brand new.
Right.
I mean, they didn't know what they didn't know.
Yeah,
there were a lot of bugs. They've made a lot of improvements to the system, and they've really accepted input from those of us who are on the front lines helping people to help them make the website better. So
that makes your job a little easier too.
It does. It really does. And it's wonderful for us this year having Access Health staff right on site. They're right across the hall from my team, and so they're there to help with things like password resets and things like that we can't do. We help people log into the consumer portal just like you would do at home. We don't have any special access or anything like that, but they do. So we can walk the client right across the hall if we're having an issue, and they'll log into the worker portal and help them out, straighten out any issues that they're having with their account.
Since one of your programs is the Husky Outreach Program, I want to get a little more specific. First about Husky Insurance, which is the Connecticut insurance, but you have to be able to be eligible for it. Talk about what Husky is a little bit more specific.
Husky is the state Medicaid program, and it's income based, but in Connecticut the income guidelines are pretty generous, and there's different income guidelines for different situations. So you know, the Husky was originally created for children. It was really to make sure that children had insurance and had access to health care. And then it was expanded to adult caregivers of children and single adults or married adults with no dependent children. So, and then in January of this year, the income guideline for those adults with no children was expanded. So more people now are eligible.
More people are eligible, and that's a good thing, but initially it didn't seem like there were a lot of locations or doctors themselves that accepted Husky, probably because of you know, what was willing to be paid out. I don't know, however they work it, but that was the case, right?
Yeah, that tends to be true, especially for adult providers and specialists. A lot of the private adult providers and specialists don't take Husky because of the reimbursement rate. Pediatricians in general do, because it's a major insurance source for many children, and all community health centers take Husky. So we have a large population of Husky insured clients.
So the Husky Outreach Program, what is that?
Well, really what we do is we reach out through community outreach events to people and let them know what the guidelines are and how they can apply, and we actually help them apply. And now Husky enrollment is done through the Access Health website. So it doesn't matter what insurance you're applying for, it's all done through the Health Insurance Exchange. Yes.
And does that make it more convenient?
It does. Yeah. It does. I think it makes it a little less confusing and a little more seamless, so that if you're not eligible for Husky, you know, the plans that you are eligible for are presented right there on the website. Speaking
of the website, we're going to go to a break now, but I'll have you give out the website for people to go and learn more. What is it?
It's www.accesshealthct.com.
Okay, and so we'll take a break and come back. Yolanda Bowles is the Director of Community Outreach for UCFS. I'm Sean Murphy. This is For the Record. Stay with us. Welcome back to For the Record. I'm Sean Murphy. My guest is Yolanda Bowles. She's the Director of Community Outreach for UCFS. And one more time on what that acronym stands for?
United Community and Family Services.
When we went to the break, I had you give out a website. You gave out the Access Health CT website. How about a UCFS website?
Sure. It's just www.ucfs.org.
And what's on the website for people to see?
All of our programs and services are medical, dental, behavioral health services, our community-based behavioral health services, our community outreach department. You can meet our providers. We have a patient portal. We have forms and links to other community resources as well.
Yeah, it's a lot of stuff on there for people to go on.
It's a very big website.
Can answer a few questions at the very least before they call you up and talk to you, right?
Absolutely.
So we talked about the Husky Outreach Program. Another program is called the SNAP Outreach Program. And I think people are familiar with SNAP. What is SNAP?
Sure. SNAP stands for Supplemental Nutrition Assistance Program.
There's a lot of acronyms.
There are. And that a lot of people know it as the food stamp program. So it's a federal food assistance program. And we have grant funding to do outreach to help people learn about the program, learn what the eligibility requirements are, and also enrollment assistance.
Now people know it as the food stamp program, but really food stamps themselves, that went away a long time ago when they started doing the card, right?
That's true. They have a card that works a lot like a debit card now. So the money is loaded on at the beginning of the month, and they just swipe it through the card reader, just like any debit card at the grocery store. And so what we do is we just really go out into the community. We have a SNAP outreach worker, Lilith, and she goes out to many different community locations. She has some regular hours there, and they will set up appointments for her, or she'll set up her own appointments, and she'll meet with clients. So the goal is really to go into the community where the clients are, so they don't have to travel too far, and help them with the enrollment process. It's a pretty long application form, and it asks for a lot of personal information and financial information, but all of that information is used by the state to determine how much food assistance dollars that family can receive.
And it based on income again?
Based on income, and also expenses as well. Housing and utility expenses play into the amount that the person can receive. And we also partner with the DSS bus, which is a mobile bus that DSS workers go out on, and we help with the enrollment process, and then the client can go on the bus and meet with a DSS worker on the spot and do their interview, and it just helps move the application process along.
I definitely think that is the future, and you know, going satellite locations, but also going to where the people are, as opposed to trying to get them to go to maybe one centralized location.
Mm-hmm.
And when you say from your staff goes out, I mean, there's a lot of locations all over the state that she'll go to, just to make it a little bit easier for some people.
In New London County,
Right,
we
right.
basically serve New London County with that program.
Okay, and that's certainly needed. And how's the funding on that, by the way?
It's good. We just
Yeah.
got a renewal of funding, so we're good for 3 more years.
Okay. There's another program that's specific to pregnant women. It's sort of a almost like a spin-off of the Husky program. It's Healthy Start. Talk about that a little bit.
Healthy Start is the Husky program for pregnant women. The income guideline for pregnant women is higher in the Husky program, and the Healthy Start program helps with enrollment in Husky, but it also goes a lot further. We're really looking at reducing risk factors for pregnancy. We're looking at making sure the woman has a healthy pregnancy and gives birth to a healthy baby, and is equipped to take care of her baby. So our Healthy Start case manager does a complete risk assessment and needs assessment, and then she, based on that assessment, she'll link the client with whatever resources in the community that will help them to be healthy in their pregnancy and have a healthy baby. So, for example, dental care is very important when you're pregnant. You want to have a healthy mouth, healthy teeth, healthy gums, and pregnancy can really affect your oral health. So we want to make sure that the pregnant mom gets into dental care and gets to see the dentist and the hygienist and gets any problems taken care of. We also want to make sure that her nutrition is good, so we will make referrals to the WIC program at TVCCA. And
there's a lot of interaction, isn't there?
A lot of interaction. Yeah. And most importantly, we want to make sure that they get into see an obstetrician for their medical care. And so we'll make that referral as well. And getting the insurance is the first step to that.
Is Healthy Start, is that one of the newer programs?
No, Healthy Start's been around for a very long time. I actually don't know how long. That's how long it's been around.
How long have you been the director of community outreach?
I've been with UCFS since 2007. So
have you seen it evolve a lot since you first started? Have there been lots of changes? I would imagine just simply more programs being added, right?
There have been a lot of changes in terms of how we do our work. You know, paper applications, and now getting into more electronic environments. That's really been the biggest change.
You have to evolve, right?
We do.
Yeah.
We have to evolve, and you know, and we work very closely with Department of Social Services, so all the changes that they undergo really affect what we do and how we do it.
Another one of your good relationships in this neck of the woods is with the hospitals, like for example Bacchus. You have a good relationship with them. Yes,
we have a very good relationship with Bacchus Hospital, and we have a partnership with them for our Access to Care program. So we have you know, our Access to Care specialists at our health centers that serve our health center locations, but we also have now 3 Access to Care specialists with Bacchus Hospital at their locations as well. So We have a full-time person that works in the Bacchus emergency room at the Norwich campus and at their Plainfield campus. And then we also serve their health centers, some of their health centers as well in Colchester, Montville, and North Stonington.
Yeah, so they're definitely, again, out in the community.
We are. We try to be wherever people need us to be.
What are some of the day-to-day duties of the Director of Community Outreach? Obviously, one of them is being a PR person, going on TV, right?
I guess that's kind of an unintended consequence.
Yeah, you weren't aware of that until recently.
That's right. But this is a fun part of my job, is to get out into the community and try to just talk about what we do and let people know that we're here. And then really more boring things like grant reports and.
But that's a necessity of you know, nonprofits and places that are getting grants and. You know,
absolutely, we really have to. You know, there's a lot of emphasis on data collection and data reporting because when people give you money, they need to know that it's well spent and that you're using it wisely. So that's the reason for all the reporting. But the best part of my job is just managing the staff that work for us. They're the most caring, compassionate group of people you can imagine, and they're very dedicated to their work. They do a great job. You know, they really try to treat people with respect and dignity, and they're just awesome people.
And you're no stranger, being the person at the top, you're no stranger to helping an individual in need. I mean, you barely made it to this taping today because you were helping somebody out, right? It was like a last-minute thing.
I was. We've been very busy since November 15th, since open enrollment started. We see people typically by appointment, but people walk in, especially now that they know that we're participating in open enrollment, and we have the Access Health CT staff located in our office, so people walk in all the time. And just before I got ready to come here, somebody walked in looking for help, and everybody was busy. So you know, I was available, so I decided to pitch in and help, and it did. It took a little bit longer than than I thought it would. But
now, obviously, because of this time of year, you're busy with the open enrollment. Depending on the time of year, are your job duties different, or are you more busy or less busy, depending on anything to do with the holidays or maybe in the warmer months?
The warmer months tend to be a little bit slower. July tends to be a little slower, but August was very busy with, I think, when families are getting ready to go back to school, getting their kids in for physicals. We tend to see an uptick in activity. You know, the important thing for people to know is that even though it's open enrollment for Access Health, you can apply for Husky anytime. So for people who are, you know, losing their insurance for some reason, there's also special enrollment circumstances as well. So people who are losing insurance or who have Husky insurance, they can enroll at any time during the year. Or people who move into the area and they need to apply for insurance, that would qualify them for a special enrollment circumstance, so they can enroll anytime.
That's good for people to know. If they're confused or have questions, you know, or any more questions aside from what they've learned today on the show, what's the best thing for them to do?
Well, the best thing to do, I think, anybody who doesn't have insurance, who you know, should really look into whether or not they're eligible, either by calling Access Health CT directly or by calling us at UCFS. Our Access to Care phone number is 860-822-4798.
All right, we'll put a graphic up on the screen for that too. We'll also take one more break and come right back. I'm Sean Murphy. This is For the Record. Stay right there. So before we wrap it up, quickly, one more program that you want to mention.
Sure. I'd just like to mention our program that it's the Medical Home Program for Children and Youth with Special Health Care Needs. It's a mouthful, but what that program, it's very important. It's a free program that provides care coordination to families that have a child with a special health care need. And that can be any chronic condition ranging from asthma that they maybe need a little bit of help managing, to autism, ADHD, behavioral health needs, to more, you know, serious conditions. such as cerebral palsy or anything
Right.
anything that a child is suffering from. And what our care coordinator does, she really works with the primary care provider, the pediatrician, to make sure that the child's health care needs are being met, and link them with programs or services in the community that can help to meet those needs. So she works a lot with families in creating a plan for their school, or for transitioning from, say, a childhood healthcare provider to an adult care provider. She provides too many services really to mention, but
that's a good way to wrap up the show. One more time quickly on the UCFS website.
Sure, it's www.ucfs.org.
Yolanda Bowles, Director of Community Outreach for UCFS. Been a pleasure having you on the show. We learned a lot today.
Thank you very much for having me.
You can see this show and many others on our YouTube site. Until next time, I'm Sean Murphy. This is For the Record. Take care.